Hello, everybody. Today I'm going to be talking about the anemic condition, or known as anemia. So, anemia is defined as a low number of red blood cells. In a routine blood test, anemia is reported as a low hemoglobin. A hemoglobin is the main protein in your red blood cells. It also carries oxygen and delivers it throughout your entire body. If you have anemia, your hemoglobin level will be too low, and if it is low enough, your tissues and organs may not get enough oxygen, which will lead into a complete shutdown of that organ. There are more than 400 types of anemia, and they're divided into three main groups. Which is the first one, which is implemented by blood loss. The second one being decreased or reduced of red blood cell production, and the third one being the destruction of red blood cells. Um, there are different types of anemia. They all have different causes and treatment. In some forms, like the mild anemia that happens during pregnancy, aren't major concerns. However, there are more types of anemia that are very severe and lifelong, like the aplastic anemia, or the Fanconi anemia, or the iron deficiency anemia, just to name a few examples. Um, so that's when we lead into with people that have anemia appear paler and more often complain of being cold. So they're more paler from the skin, and they complain about having parts of their body being cold, or just them being cold in general. They may also experience the lightheadedness or dizziness. They might have unusual cravings, trouble concentrating, or constipation issues. Um, Actually, some types of anemia can cause inflammation of the tongue, and resulting in a smooth, glossy red, and often painful tongue. The blood oxygen levels can be so low that a person with severe anemia can actually have a heart attack. So, diagnosis of anemia begins with both your health history and your family's health history, along with a physical exam. A family history of certain types of anemia, such as sickle cell anemia, can be helpful. A history of exposure to toxic agents in the home or workplace or a restaurant, wherever you eat, might point to an environmental cause. Laboratory tests are often what is used to help doctors find out the cause of the anemia. Some tests include CBC, which is the complete blood count, which shows the number of size, the number and size of the red blood cells. It also, if the levels of the other bloods, like white blood cells, like it shows the level to see if they're normal. One of the easiest, or one of the less fortunate, would be the vitamin B12, which is your dietary supplements, which is if it's too low, they might prescribe you with vitamins or a change in your dietary intakes. And the most interesting to me was the stool test, which applies a chemical to the stool specimen to see if blood is present. If the test is positive, it means that the blood is being lost somewhere in the gastrointestinal tract, from the mouth to the rectum. Problems like stomach ulcers and colon cancer can cause blood in the stool. So some treatments are different from others. Your doctor may not treat your anemia until the underlying case has been established. The treatment for one type of anemia may be both inappropriate and dangerous for a different type of anemia because there's so many types. Um, if you have, for example, an aplastic anemia, you might need medication as well as a blood transfusion or a bone marrow transplant, which is different from vitamin B12 anemia, because all you need to do is just take a few vitamin supplements or change something in your dietary intakes. Um, the same with sickle cell anemia, which includes a lot of painkillers and different types of supplements and antibiotics. And there's one for blood loss that you might even need surgery to fix the bleeding. And if you have iron deficiency anemia, you'll probably need to take iron supplements to change your diet, and so on and so forth. And in some cases, the anemia is severe. The doctors would use an Ethiopian injection to increase red blood cell production in the bone marrow. And those are my works cited pages. Hope you guys enjoy. Thank you.